Hi, everyone, and welcome to Lecture 6 on Hippocratic Medical Ethics. So, ethics is the study of how a person should live and act. It's the branch of philosophy that's concerned with figuring out which kinds of actions are morally right, which kinds are morally wrong, and why. So, why we should or should not act in certain kinds of ways. Medical ethics, then, is the study of ethical issues that arise in relation to healthcare, how physicians should behave, and what kinds of principles we should adhere to in treating patients. So, what we'll be looking at today is the Hippocratic approach to medical ethics and the guidelines that Hippocratic authors are offering to physicians about how to conduct themselves professionally. In order to understand the guidelines that we're going to be seeing today, it's important to keep in mind what the aims were of Hippocratic ethics. That is, what were the goals of the Hippocratic authors who were writing these treatises in offering these ethical prescriptions to Hippocratic physicians? And there's a few goals, but the number one goal was establishing a good reputation for the art of medicine and for doctors in general. So recall that at this point in Greek history, medicine was not established as a profession the way it is today. And so Hippocratic authors were very much concerned with making sure that people recognized that this was a genuine expertise, a genuine art, and that it was an art of healing that could actually be trusted. So they're offering ethical prescriptions with the idea being that if you have physicians in the Hippocratic tradition sort of universally acting in ways that are ethical and upstanding, then doctors will tend to become trusted and people will tend to trust the medical field in general. So they want for medicine to succeed as a profession, and to that end, they want doctors to behave in ways that will be conducive to people in the public having a favorable impression of the art of medicine. A sort of secondary and closely related goal, of course, is that they want individual doctors themselves to have good reputations. So obviously, because this is a profession, doctors are going to be able to make a living better to the extent that people actually trust them and think well of them. And so part of what they're doing in these ethical treatises are saying, here are the guidelines that you should adhere to if you want people to trust you as a physician and if you want to be successful in your field. They were also very much concerned with the health of the patient. So a lot of the ethical principles that we're going to look at are oriented toward producing the best possible health outcomes for the patient. So these are the three main goals. And as we go through the ethical principles today, and as you read through the PowerPoint on your own later on, I would encourage you to sort of constantly be thinking of these three and with these three goals in mind, and thinking to yourself, how do these ethical principles, these specific principles, help one or more of these goals? And I'll talk through several of them, but I'm not going to go through all of the PowerPoint in as much detail as usual today, because I think a lot of it is, or at least some of it is, more self-explanatory than usual. One final thing to note is that Hippocratic ethics is not just concerned with morality just for its own sake. So they're not offering these ethical treatises with the idea that, like, if you want to be a good person, here's the ways that you need to act. Rather, it's a very practically oriented ethics. It's not about this is what you need to do in order to be a good person. It's about this is what you need to do in order to be a good doctor. So they're not just concerned with morality for its own sake. They have these important practical goals in mind in offering their prescriptions. Okay, so in terms of the rest of the PowerPoint, the way that I've organized it is I've organized it sort of topically, and then each bullet point is in the form of a specific ethical recommendation issued from the perspective of the Hippocratic writer to aspiring physicians or to Hippocratic doctors. So pursue medical knowledge is a recommendation that the Hippocratic author is making to the physicians who are going to be reading this. And here on this side, you can see that these principles emphasize very much the value of education. Recall that for the Hippocratics, again, it's very, very important to them that medicine is a branch of knowledge and a branch of expertise that has to be studied at length and learned, and it's a very complicated science. So a lot of their ethical principles have to do with the way that that knowledge is transmitted, making sure that the people who practice medicine have all of the knowledge that they actually need in order to practice it effectively, and so on. One sort of interesting side note that comes out in one of the treatises is that the Hippocratics actually present medicine itself as a kind of philosophy. So at this point in Greek language, the word philosophos, lover of wisdom, where we get the word philosophy itself, was relatively new in the Greek language. And people like, Plato and Socrates and other well-known philosophers thought of themselves as philosophers in the sense of loving knowledge, pursuing knowledge, and devoting their lives to the pursuit of wisdom. And interestingly, the Hippocratic author actually presents Hippocratic medicine itself as a form of philosophy, as a way of loving wisdom. The idea is that in devoting yourself to the pursuit of understanding the human body and human beings and the nature of health and disease, that actually is a way of living a life in the pursuit of knowledge or wisdom. Because it is a skill or expertise that is taught from one person to another, a lot of their ethical principles have to do with having a great deal of reverence for the process of education itself, and in particular for the teacher-student relationship. They were also very careful about wanting to make sure that people didn't teach medicine to just anyone. They wanted to make sure that, upstanding people who are going to be good representatives of the Hippocratic tradition are practicing medicine. That way, again, that will help to promote the reputation of the field among the broader public. So we see that the Hippocratics have a duty of benevolence. So they're supposed to help the sick. This is from the famous Hippocratic Oath. They're also supposed to abstain from all intentional injustice and harm. And note that the word intentional is really important there, because Hippocratic doctors recognize that it will sometimes happen that due to ignorance or a mistake, they might recommend something to a patient that they recommend with the intention of healing them, but it actually could make them sicker or harm them in some way. And so they recognize that, even though they're trying their best based on the knowledge available to them to figure out how to help patients, because medicine isn't an exact science, there will sometimes be unintentional harms. But the important point is that they should never willingly or intentionally use their knowledge of the human body to harm somebody. They should, of course, never abuse their power by engaging in sexual relationships with patients, and certainly not acts of sexual assault or violence. So this is interesting. They have a few different principles that are related to being discreet. So not gossiping, never disclosing private information that they obtain about people in the course of treating them as patients. And here I think it's important to clarify something. So in light of how we think about the medical profession today, it would be easy and I think natural to interpret these principles in light of the idea of like doctor-patient confidentiality. But I want to emphasize that the Hippocratics were not concerned with doctor-patient confidentiality in our sense of it. Rather, what they were concerned with was this. So doctors in the ancient world were going into people's homes and spending a lot of time in their private homes. The household in ancient times and in ancient Greece was a very, very private place, even more so than we might think of it today as being. And it didn't just consist of the nuclear family. It also often included extended relatives, maybe servants who lived there. And so it was something like a little community. And the idea is that when a doctor is going inside somebody's private space for extended periods of times and making frequent visits, they might learn or see some of the family's, so to speak, dirty secrets or things that they wouldn't want other people to know. And the idea here is that they shouldn't be disclosing any private gossip about a family or what's going on there or the bad ways people are behaving or any other sort of things that they learn through their professional life. And again, you can see how this serves the aim of creating a good reputation for the art of medicine as a whole. If doctors are known for, learning juicy details about their patients and then spreading gossip, then people are going to be more reluctant to invite doctors into their homes. But they weren't really concerned about disclosing private patient information about their actual medical cases. So, for example, when we look at our case studies at the end of the semester, we'll see that these are doctors' notes on specific individual patients and all of their symptoms. And there's no worries at all about doctor-patient confidentiality. On the contrary, they're like, here's this guy's name, here's his address, and here's what happened to him day by day in every gory detail. So they weren't concerned about, and then they published these treatises for one another. So they weren't concerned about that in our sense, but they did want to make sure that doctors didn't become known as gossips. They thought that doctors in general, this goes back to the reputation issue, should have good moral character in general. So they should be gentlemen, because in this time, doctors were men. They should be kind and philanthropic to people. They should be fair and just. They should be moderate. So in general, like the idea is Hippocratic ethics didn't just extend to the particular times that the doctor is with their patients. It was sort of supposed to be a whole way of life. Like if you wanted to be a doctor, then you needed to be a moral person and treat others well in general. And again, this is about protecting the dignity of the field and establishing a good reputation for the field. They want doctors to be trusted, and people aren't going to trust doctors if they see them, acting a fool, getting drunk in the streets after hours. So they don't want people who are known as bad people or scoundrels or whatever to become doctors. They want doctors in general to act ethically and fairly and justly in all of their conduct. Okay, so in terms of bedside manner, a couple things to note here. So they're supposed to be ready to answer questions, and they're supposed to be stubborn when necessary in the face of doubt or resistance. They're also, in general, supposed to be, direct, clear, and eloquent. A lot of these principles about bedside manner are related to this idea that we see in Hippocratic ethics, which is that Hippocratic doctors need to be persuasive. They need to be able to speak in a way to their patient that convinces them to agree to the various kinds of treatments, plans, or medications, or whatever it is that they're recommending. And one reason for this is, again, first of all, doctors didn't have like an unquestioned authority at this time. They weren't established as professionals in quite the same way that they are now. But also, in addition, based on what we learned last week, a lot of the treatments that they would be recommending would be really unpleasant or even painful. So, they're asking patients to take purgative drugs, for example, or to submit to a painful surgical procedure. And in order to get skeptical patients to be willing to allow this sort of strange doctor to do this to them or to submit to that painful or unpleasant treatment plan, they need to be really good at answering questions convincingly and making sure the patient understands why this is the appropriate treatment plan and convincing them that it is in fact best for them. One thing that it is also worth noting here that comes out in this passage is that note some of the language here. Perform all this calmly and adroitly, concealing things from the patient while you are tending him, turning the patient's attention away from what is being done to him, revealing nothing of the patient's future or present condition. So one of the things that we see come up in Hippocratic ethics is that they aren't concerned with what we would today maybe call like informed consent of the patient. The Hippocratic doctors think that sometimes you actually should lie to, deceive, or conceal information from a patient. And in particular, you should do that whenever giving them all of the information available would potentially sort of cause them distress or anxiety or make them less likely to recover and get healthy again. So in other words, they weren't concerned with patients knowing every detail about their own case and being able to give their consent to everything that's being done to them and understanding the consequence of all possibilities. They didn't have that notion that we might have today. Rather, they thought, look, the number one goal here is make the patient healthy. And so sometimes what will be best for a patient when it comes to making them healthy, what will maximize health outcomes, is actually deceiving the patient or keeping information from them that might cause them distress and might make them worse. So that's just sort of an interesting sort of contrast to note. Another thing is that they believed that it was important to understand who the patient was as a person, what kind of character they had, and to account for that when you're making recommendations to the patients and prescriptions to the patients about treatment plans. So they say, for example, that you shouldn't prescribe a long-term regimen of abstinence that suppresses, quote, a long-standing desire of the patient. The idea here is that they want to, they're being pragmatist. They recognize that, take somebody who is an excessive drinker. They might think that, look, realistically, given who this person is, suppose it's somebody who is proven, especially like recalcitrant in the face of, trying to stop drinking. What they might recognize is, look, it's not going to be reasonable to ask this person to stop drinking altogether. If we tell them to do that, then they're just not going to follow through at all. Rather, we should try to meet people where they are and maybe find a compromise plan that will be better for them. So it's kind of like a harm reduction sort of approach. Like drink less or only drink this amount rather than as much as you've been drinking. So it's a way of saying, like, look, when you're issuing recommendations, make sure that you're issuing recommendations that that particular patient is actually going to be likely to follow through with. Don't do things that are going to be impossible for them to stick to, given who they are. Physicians are supposed to always sort of be prepared. So remember, they are often itinerant or traveling around. So they need to have, a portable case ready that they can take with them on the go. And the case needs to be well organized so that they can quickly pick out which tools they need, whatever herbs they need to prepare drugs, they know right where they are. So it's really just sort of like a way of be organized, because that's going to facilitate you being the best possible physician when you meet with patients. They also should visit frequently their patients. And that's related to the fact that, as we've seen, the relationship between the humors and foods and drinks and drugs and various Hippocratic medical techniques like purging and bloodletting, there's so much instability built in there. They're constantly trying to make adjustments to the patient's internal humoral balance to restore balance. And it's very, very easy on the Hippocratic way of thinking to either overcorrect for something or undercorrect for something. And if you undercorrect or overcorrect, then you can make something go bad in a different direction. And so what you want to do as a doctor, ideally, is visit the patient a lot ideally daily. That way you can constantly be checking up on them and seeing, okay, based on the adjustments we made to your diet yesterday, what has changed since then? Did we overcorrect? Did we not go far enough? Okay, let's make a new adjustment based on that. So again, in order to have the most effective health outcomes, they think it's important to not just visit your patient once and give them a recommendation and go on your way, but keep checking in with them and making adjustments in real time as you see how the patient is responding. One of the important concepts in ancient Greek thinking in general and in medical thought in particular is the notion of the kairos, which is a Greek word that means either opportunity or opportune moment. So the Greeks thought that there are certain kinds of processes where there's a right moment to do something, and you have to seize the right moment, or you're not going to be as successful in what you're trying to do. And this applied to the case of medicine. Doctors thought that diseases have certain ways of progressing, and there are certain points in the disease where certain kinds of medical interventions are going to have the maximally beneficial effect. And so part of being a trained physician is knowing what the opportune moment is, knowing what the kairos is, and seizing that moment to perform a particular medical technique or administer a certain drug to the patient. Other ways that the notion of kairos appears in Greek thought, to give you a couple ideas, is in the notion of planting crops. So if you want your crops to have like the best possible yield, there's a time in the season when it's too early to plant your seeds. If you plant them that early, then maybe they won't grow at all, or they won't grow as well. There's also a point where it's going to be too late. Like maybe they'll still grow, but again, you're not going to get as bountiful of a yield or as lush of a yield of your crop. But somewhere in that season, based on all the various weather factors and seasonal factors, there's going to be like just the right day when that's the day to plant your seeds so that you maximize the crop yield. That day or that moment is the kairos. Another example is that in navigation, winds are constantly changing on the seas, there's weather patterns, and a skilled ship captain will know that when it's the best moment, the opportune moment to leave for a journey so as to maximize the possibility of the journey's success and make sure that it goes as smoothly as possible. So similarly, Hippocratic doctors think that there's certain moments in diseases where you need to seize the opportunity. And so part of what Hippocratic doctors are concerned with is figuring out what that time is going to be. It's also really crucial for Hippocratic doctors to know the difference between what medicine is capable of and what it's not capable of. And Hippocratic doctors are not supposed to treat cases that are considered obstinate or desperate. Obstinate or desperate cases are going to be the cases that are beyond the limits of medical expertise to actually heal. So what do they have in mind by these obstinate or desperate cases? Well, presumably it includes some cases where it's just going to be a sort of terminal case where it's obvious that there's nothing left that can be done for the patient, that the illness is going to result in death. But even more than that, what they have in mind are cases of chronic or permanent conditions. So the two that get talked about a lot that are good examples are blindness or paralysis. Hippocratic authors are saying, look, we do not have the expertise or the knowledge to understand how to address these ailments or these conditions, and so we shouldn't try. Basically, if we have patients who have conditions or illnesses that we are incapable of treating, we shouldn't even try to treat them, because doing so is going to inevitably be unsuccessful. And then that's going to, and again, this is the concern for reputation, that's going to make medical doctors look bad. It's going to count in the failure column for medical doctors. Okay. So, yeah, I would suggest looking this PowerPoint over in more detail on your own and reading through some of the passages. But at any rate, that is a sort of quick overview of Hippocratic ethics. And I will see you all next week.